following segment is sponsored by Baptist Health.
50 years ago, Baptist Health introduced the Baptist Health Rehabilitation Institute to Arkansas. Over that time, it has grown to become the state's largest provider of inpatient and outpatient rehab services. Excited to be joined by President Kourtney Matlock this morning to talk about this amazing place. Good to have you here.
Thank you so much for having me.
How do you even begin to explain what you do as the largest provider of all these services?
That's a good question. So as you mentioned, we are a 120-bed rehab facility, and we're located on the Little Rock campus. Our focus is spinal cord injury, brain injury, amputee, and stroke. We're the only CARF accredited program in the entire state for those services. And so our goal is to get patients back to the best version of themselves.
Yeah, so get into those services a little bit more. So you mentioned those three things specifically, but I suspect there are other things as well, right?
Absolutely. So we're also specialized in comprehensive services. So for any patient that has any kind of need in terms of rehab, we have inpatient facilities. So in an inpatient facility, it's required that you have 3 hours of therapy a day. We also have outpatient therapy centers. We have 23 outpatient therapy centers across the state of Arkansas, anywhere from Monticello all the way up to Fort Smith. And then we have home health services. So we have therapy, again, laced into all of our home health services that covers the majority of the state. So if the patient starts out in rehab and they continue to need therapy services, we can meet them wherever they are.
I love taking a look at some of the video you've got right here. And one of the things that I am absolutely fascinated with is, you know, the road back and the hardships they're having to overcome differ for everybody, but it's a long, grueling road sometimes, but you've got so many things in-house. I guess, what would you call them? More or less, you're mimicking the environments that they'll have to see when they get home, right?
Yes, we are so blessed that we have a very large rehab inpatient facility within the hospital that mimics a lot of those environments. So we have David's Village, which mimics a grocery store environment, a dining experience, and it also has a car, because once you have a stroke or you have some sort of other injury, getting in and out of a car can be difficult. We also have a bedroom environment where you can make your bed or you can fold clothes. Those are very simple tasks, but our goal is to get you back to doing them.
And the challenge you face as somebody who's had a brain injury as opposed to somebody who has had a spinal cord injury are oftentimes much different, but you still have to navigate those same
That's absolutely correct.
Places.
And we have technology to help with those even more severe cases. So we have a Locomat, which mimics walking for those patients. Again, you can't do that on your own, but that sort of technology allows you to do that. And we have the best technology in the state.
Kourtney, when you have someone come in who literally has faced the biggest trauma of their life, and they work with your team of specialists and experts, and they get to walk out of there or be the best version of whatever they can be, that must be just a tremendously satisfying moment for patient and staff.
Absolutely. The patients come back and they see their therapist and they tell them about their progress, and I would say it's not just a job, it's a mission, and so it's incredibly rewarding to see them come back.
You have other clinics providing services as well, right?
We do. Again, we have 23 outpatient therapy centers across the state, and so if you are at BHRI for 12 days, we continue your journey for however long you need, and we're very accustomed to seeing our patients for many, many years.
We are blessed in this state, certainly at Baptist Health, to have some great surgeons and doctors out there, but without the proper rehab, it just doesn't happen.
That's correct. You can obviously come out of the hospital and have a great experience while you're in the hospital, but we want your quality of life. We want your ability to hug your grandchildren again, to walk again, to really thrive in life, and I think that's what rehab provides, is the ability for our patients to really thrive.
You've been around for like 15 years.
That's right.
Right. 3 years as president. Does the technology and the specialization continue to make things better and better for you and the patients as well?
Absolutely. I mean, just this year we added a driving simulator to our host of technologies, and so not only has it been fantastic for patients, because driving again is a goal for a large portion of our patients. Can you imagine not being able to drive again? And so not only is it fantastic because it mimics all sorts of environments. You're driving a large truck, you're driving a car, snow, rain, city, rural. But it also is much safer than putting someone in a car for a driving evaluation.
No question about it. And to make those adaptations where they're needed, so they can get back to doing that. You've got something coming up you want to talk about real quick.
We do. We have a new brand campaign. 50 years. We are so blessed that we're going to be able to really highlight our staff that have been at BHRI for a very long time and the amazing work that they do. And we're going to be able to highlight our brave patients and their stories and their journeys. That's exciting for us. It's what we do every day. So we're excited that that's going to be coming out in a couple weeks.
You're going to have a lot of success stories to choose from, I
Absolutely.
suspect.
It's hard to pick.
Again, if you have somebody in your life who may need to use these services, there's the number for Baptist. Any other direct way? You have the number right there to the Institute on the bottom of your screen.
Yes, 202-7000, and you can make direct referrals. You do not have to go through a physician for those referrals.
Great to know.
So please call us. We're happy to help you.
Yeah, and that Baptist number will get you to them. All you got to do is ask.
That's right.
Kourtney, thank you so much for talking to
you.
you. Congratulations on 50 years.
Thank you so much.